This is Professor Miller, and I'm going to do a quick tutorial on how to enter information in eMedley for case logs. This presentation is going to be just very basic. There's no frills, but it will get you through and have you entering information accurately. So after you sign into eMedley, you're going to click on Clinical at the top. Then you're going to go over and click on Case Logs. Obviously, this is a training site, so there is information already added here. So click on Add. So you're going to be adding a case log. You're going to choose the date that you saw the patient. So this patient was seen on July 2nd of 2020. This is the general information screen. There are several individual screens that we're going to go through. Then you're going to choose the period. So the period is going to be the actual semester that you're in. Then you're going to choose the setting type. So for psychiatry, settings that you could be getting clinical in would be an emergency room, an inpatient setting, an intensive outpatient setting, outpatient, partial hospitalization program, or a substance abuse program. So that should pretty much cover all of the types of settings that you could be in. So to recap, the setting type, choose only one of the following: the emergency room, inpatient, intensive outpatient, outpatient, partial hospitalization program, or substance use chemical dependency. Clinical site is going to be chosen next. Again, I encourage you to use the search bar at the top. Search bar works pretty well. For this example, I just picked the UC College of Nursing. Then you're going to choose the preceptor. And again, I encourage you to use the search box because your preceptor will pop up when you start typing their name. Then you're going to pick the section. So for internship 1, in the postmaster's program, it is ANPS 8028. If you're in the DNP program, it is ANPS 8020. And I also listed the numbers for internship 2 and internship 3. Then you're going to save it and then click on Next. Then this is your patient demographics. So this is the next page that you're going to fill out. So you're going to choose their age. I would just do years. The gender, the race. Anything that has a little red asterisk next to it is what is required. Then the next page is going to be clinical information. So the previous one, you're going to click Save and Next, and then you're going to get to this form, this next page. So you're going to enter the time with the patient. So we encourage you to round this to the nearest either 10 or 15 minutes. So you're going to put your time with patients, but you're not going to put anything in the consult with preceptor time. That should always be a 0. And I can't stress this enough because I do have students that put time in there and then they have to go back and fix their case logs. So it's important that you don't put any time in there, because what we're counting in case logs is your face-to-face time with patients. So the complexity of the interaction, and I encourage students to talk to their preceptors about how they would rate the interaction, if it's straightforward, low, medium, or high. And then student participation, you'll choose one. You're either observing, assisting, or performing. Chief complaint. This is an area that has to be filled in, but for chief complaint, you're just free texting, and I would just make something very brief. And then the reason for the visit for the psych mental health program, just put care for psychological and behavioral conditions. You can put, so again, reason for visit, there's only really 3 things that you should be choosing: care for psychological or behavioral conditions, initial visit, parenting, family education, and counseling. So one of those 3 should be what you're choosing. So you can search for any of those 3. And then you're going to click OK, and that will populate. And then again, you're going to save and do next. Under diagnosis, you're going to click add. You're going to type in a diagnosis and they will pop up so you can choose one. So for this one, I chose generalized anxiety disorder. Again, we're clicking save and next. And then that takes us on to the procedure screen. There's nothing to do in the procedure screen. So just click next and it'll take you on to the next page. Again, in the clinical experiences, there is nothing to add here. So you're going to click on the next page. And this is where your note gets put. This is an example. Client is seen for follow-up related to anxiety, CBT intervention utilized. Client was able to identify negative thoughts when challenged by therapist. Given homework to do with parents, identify 1 negative thought daily and provide evidence to validate or not validate the thought. The other piece that I would ask you to put in here at the very beginning is if for some reason you're doing telehealth therapy or telemedicine, medication management, if you put that at the very beginning of your note. And then once you get your note entered, again, brief, we want for internship 1, we're looking for what kind of therapy, the patient response to the therapy, and the plan for the next visit. And you're going to click save and finish. And then submit for approval is a yes. And then to update your notes, please note notes and case logs may not be copied and pasted from one encounter or individual contact. Each encounter is unique and requires a unique note. In some of the other online trainings, there have been mentions of having students copy and pasting their notes because they're doing the same thing, and that's not the case in psychiatry. Every note should be unique to that individual patient because every patient's going to have a different response, have a different plan, even if the diagnoses are similar. Okay, all case log notes are automatically approved, so you don't have to worry about that. You do not have to approve them. Your preceptor does not have to approve them. So you can see this first person on here. My preceptor was preceptor test. UC College of Nursing was got a 10-year-old for out of control behavior on July 2nd of 20. I made a mistake. Now what do I do? How do you edit case log entries? In order to edit case log entries, students will need to make a duplicate case log entry and then edit the draft in order to submit it. Finally, going back and deleting the incorrect entry. That's all I have, and thank you for your attention, and I hope we have a very successful semester getting all this information entered into eMedley correctly. Take care.